Hello, I'm Emma Howard and I'm joined by Dr Su Laurent, who's a consultant paediatrician at Barnet Hospital in Hertfordshire. Hello, Sue.
Hello, Emma.
Got a question about antibiotics here. My doctor refuses to give me antibiotics when I request them, and she says they don't work for viral infections. Surely this is simply a way of saving the NHS money. Do you get asked that?
I do from time to time get asked
really?
that, yes. I think that the parents' expectation, some parents' expectation is if their child is very unwell with a high temperature, they should be treated with antibiotics. And I think sometimes it's due to a basic misunderstanding about what antibiotics can do.
Yes, most people think it's a panacea for it all.
They are wonderful drugs, and without them we will be absolutely lost. But a lot of the infections that children get, childhood infections, are due to viruses, completely different types of organisms to bacteria. And antibiotics will only kill bacteria, not viruses. So common colds, flu, many things like ear infections, throat infections, even chest infections sometimes, well, many of them will be caused by viruses and not by bacteria.
So we need strong immune systems to fight viruses, really.
Absolutely, we do. Now, when do you need antibiotics? Well, you do need antibiotics if your child has meningitis or a urinary tract infection or pneumonia or a strep sore throat or something which we can clearly say is due to a bacteria. And that's when we should be saving them for, so that these organisms don't get resistant to antibiotics.
So are you a doctor who does think that in the past we've used antibiotics too much and we're in danger of kind of devaluing
I think
them?
we have used them too much, and we know now that quite a lot of organisms are becoming resistant to antibiotics. And that's a real worry, because although we're developing new ones, we may not be able to keep up developing new ones as fast as the organisms become resistant.
Yes, nature's evolving faster than our science levels. But it must be quite difficult when you have a parent in front of you who's thinking that you're just trying to save money rather than understanding that it's not going to work for their child.
I think that's why an explanation is very important. And I think there are some situations where antibiotics may be helpful, but often aren't. And a good example is ear infections. And so what we do with some parents now is we'll say, here's a prescription for some antibiotics. Wait 24 hours and give regular paracetamol or ibuprofen. And if after 24 hours your child is still in pain or still has a fever, go ahead and get the antibiotics. Because we know that, for example, with ear infections, you need to treat 12 children with antibiotics to make one child better slightly faster. So that tells you actually that most children just don't need them. We have our own defence mechanisms.
Yes, and we should trust in it more.
Yeah. Yes.
Sue, good advice as always, thank you. If you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.